Hey guys, welcome to our video on the post-operative guide to extractions with or without bone grafting. So in the first 24 hours, here's what you should expect. From a pain perspective, the amount of pain that you feel after the extraction has a lot to do with the difficulty of the extraction itself and the number of teeth you had extracted. The harder the tooth was to remove, or the greater the number of teeth removed, the more pain you're likely going to feel afterwards. If this pain increases significantly a few days, between 3 and 7, after the extraction, please call our office for instructions because we want to make sure that you do not have a post-operative infection. Regarding bleeding, you're going to bleed for the first 24 hours after surgery. This is completely normal. Keep in mind that when blood mixes with saliva, it may appear as if you are bleeding more than you are. Do not sweat it if you're still bleeding a little bit before you go to bed. Just put a towel over your pillow and get a little shut-eye. Regarding swelling, you are probably going to experience some degree of swelling after surgery. The amount of swelling that you have will depend on the difficulty of the extraction, the number of teeth extracted, and the size of the bone graft that we placed. The swelling is usually greatest in the first 4 days and should start to decrease by days 7 to 10. If the swelling increases significantly a few days, between 3 and 7, after the extraction, please call the office for instructions. Again, we want to make sure that you don't have a post-operative infection. Regarding sutures, if sutures were placed directly after surgery, you might feel them with your tongue. Do your best to leave these little guys alone. Messing with them is ultimately going to, well, it could interfere with the healing process, and that's not something we want to do. The time it takes for your sutures to dissolve has everything to do with the type of suture material used and how your body reacts to them. The sutures may start to come out anywhere between 2 days and 2 weeks after surgery. If non-dissolving sutures were used, our office will need to remove them anywhere between 2 and 6 weeks after the day of your extraction. Let's talk a little bit about some no-can-dos. Number 1, do not rinse with anything for the first 24 days, 24 hours after surgery. Number 2, do not spit or suck through a straw or touch the surgical site. I mean, don't even pull on your cheek to look at it for the first 7 days after surgery. Number 3, do not rub or apply excess pressure to your face to massage the area, especially if bone grafting was performed. The bone grafting needs to heal without any outside pressure for at least 3 months. Number 4, do not smoke or drink alcohol for the first 3 days after surgery, and it would be ideal if you did not smoke at all. Number 5, do not exercise, mow the lawn, vacuum the house, or play sports for the first 5 days after surgery. These activities tend to increase the risk of bleeding. So, for the first 24 hours, you should be nothing but a couch potato. Number 6, do not eat or drink hot foods or beverages, warm stuff is okay, for the first 7 days after surgery. Remember, for the first 24 hours, this needs to be strictly cold. Number 7, do not consume spicy foods, chips, popcorn, carbonated drinks, or acidic juices like orange or grapefruit juice for the first 14 days after surgery. Okay, now let's talk about some things that you can do to help the healing. First, pressure. Bite down gently but firmly on the gauze packs that we have placed over the extraction site, making sure that they stay in place, and the easiest way to do this is to stop talking. Do not change them for the first hour unless bleeding is not controlled. The packs may gently be removed after 1 hour. If active bleeding still persists, place enough gauze to obtain pressure over the surgical site for another 30 minutes. The gauze may then be changed as necessary. This is typically between 30 and 45-minute increments. It's best to moisten the gauze with some kind of water before you place it inside your mouth. Make sure that it's not too wet, but you also don't want the gauze to be dry. And then place it over the extraction site and bite down gently but firmly. Cold packs. As you leave the office and when you arrive home, use a cold pack on your face next to the extraction site to keep down the swelling. Keep the cold pack on for 20 minutes and then off for 20 minutes. You can repeat this cycle for the first 36 hours after the extraction. Regarding your medications, take all the medications given or prescribed as directed. You may have started some of them before the actual surgery itself. Take the medications with food unless otherwise stated. The only exception to this rule is narcotic type pain medication. If you choose not to take these, that's completely fine with us. As far as oral hygiene is concerned, do not rinse your mouth for the first 24 hours. Starting the day after surgery, you may begin rinsing, and if you want, you can brush and floss your teeth, but be extremely careful around the area where the surgery was performed. If you're uncomfortable brushing the surgical site, then just don't do it. This area is going to be fine for the next 2 weeks. Do not, under any circumstances, use a water pick or water flossing device, especially around the area where surgery was performed, as these are traumatic to the healing process. Rinsing with the prescription mouthwash, Listerine, or warm salt water will help to clean the treated area. To make this warm salt water rinse, simply mix 1 teaspoon of salt with a half glass of water. Make sure that it is not hot. One little bit of caution: do not rinse vigorously with this mouthwash. Instead, place the mouthwash in your mouth and then gently rock your head from side to side, bathing the surgical site in the mouth rinse. So for your diet, most patients find it difficult to sit down and eat a normal meal after dental surgery. It's not difficult to see why. Chewing or chomping may aggravate the treated area, resulting in pain. It may also reopen the surgical site, which could result in a post-op infection or healing complications. We suggest you eat a soft food diet, take smaller bites, and chew only on areas where no surgery was performed. Avoid highly seasoned foods, sharp foods, such as nuts, popcorn, and chips. It's important to maintain a nutritious diet while you're healing. The patient who maintains a healthy diet of soft foods generally feels better, has less discomfort, and heals faster. One last little piece on diet. This is in regards to vitamin supplementation. A lot of Americans probably have vitamin deficiencies that they are completely unaware of, and this may potentially negatively affect how you heal after surgery. It's our recommendation that you take a high-quality multivitamin supplement while you're healing. If this multivitamin supplement does not have vitamin D in it, make sure that you add vitamin D. Okay, days 2 through 14. So what should you expect? Regarding pain, quite often the second day is as bad, if not worse than the first, but hang in there, you're going to get through this. Again, the amount of pain that you feel is directly associated with the difficulty of the extraction, the number of teeth involved, and the size of the bone graft. Pain is usually the worst for the first 3 days and should be residing or gone by days 10 through 14. Remember, if this pain or swelling increases significantly a few days, between 3 and 7, after the extraction, please call our office for instructions. We want to make sure that you don't have a post-op infection. Regarding bleeding, you may still have a little bit of bleeding from the surgical site. This should mainly be in the form of oozing, and the appearance should be pink from the mixture with your saliva. If you're still heavily bleeding by the end of day 2, give the office a call. We'll take care of it. Regarding swelling, you may experience additional swelling from what you saw in the first 24 hours, and this swelling may continue to worsen the second day. This should level off by day 3 and slowly begin to decrease by days 4 and 5. Again, the amount of swelling will be directly associated with the difficulty of the extraction, number of teeth extracted, and size of the bone graft placed. If this swelling increases significantly a few days, between 3 and 7, after surgery, please call the office. We want to make sure that you don't have a post-op infection. For bruising, the development of a black, blue-green, or even yellow discoloration is the result of blood spreading up underneath your tissues. It's quite normal to bruise from the first 2 to 3 days after surgery. The size and length of time that you have the bruise will be directly related to the size and complexity of the procedure. Most bruises go away within the first 7 days. However, some may persist up to 14 days after surgery. This has everything to do with the size of the surgery performed, and some patients just tend to bleed or bruise more easily than others. So things you can do at this point in time. Warm packs. So after the first 24 to 36 hours, cold packs can be switched to warm packs. Although it's not necessarily required, it does probably feel good. Gentle pressure is all you're going to need, and make sure that these are not too hot. The last thing you want to do is burn the outside of your face. As far as diet is concerned, your diet after the first 24 hours will be a little bit different from the first 24 hours, mainly in temperature. Remember, the first 24 hours is cold, and then after that, everything is warm. The rule of thumb is as follows. If you can't easily pinch through it, you're not allowed to eat it. We suggest that you continue eating these soft foods and taking smaller bites and then chewing in areas where surgery was not performed. Continue taking your multivitamin supplement with vitamin D. Days 15 and on, what you should expect. From a pain and swelling perspective, you should no longer be experiencing major pain in the area where the surgery was performed. If you feel an increase in pain or swelling at this point in time, please give the office a call. Again, we want to make sure that you don't have some form of post-op infection. For sutures, if resorbable or dissolvable sutures were used, they will probably be dissolved by now. If non-dissolving sutures were used, they will likely have already been removed at your 2-week postoperative appointment, but sometimes we leave them in longer and we'll let you know if that's the case. If you feel a suture still might be present after sutures were supposed to be removed, please call the office. We want to make sure that we didn't leave one. Regarding the extraction socket healing itself, the time it takes for the soft tissues to grow over the socket can vary between 2 weeks and 3 months. The speed of soft tissue or gingival tissue coverage is related to the size of the tooth that was extracted and the health of the patient. Your back teeth take longer to close than front teeth because of the size of the extraction socket, and then healthier patients tend to heal faster than unhealthy patients. Here are some things that you should avoid. Continue to avoid using the water pick close to the surgical site for this first month after surgery. Continue to avoid rubbing or applying excess pressure to your face to massage the area if bone grafting was performed. Remember, this bone graft needs to heal without any outside pressure for at least the first 3 months. So what are some of the things that you can do now? So by the second week, you should be feeling pretty close to your old self, maybe even better. Discontinue using the prescription mouth winch. You no longer need that. Continue to take caution brushing and flossing around the surgical site, but don't be afraid to make sure that things are clean back there. As far as your diet is concerned, if your extraction was performed without bone grafting, you're pretty much free to eat whatever you want. However, it's always a good idea to continue to take smaller bites and chew only on the opposite side of where your surgery was performed. If bone grafting was performed, make sure that you take care not to apply excess pressure for the first 3 months after the surgery was performed. If the surgery was performed on both sides, make sure you continue following that soft food diet recommendation that we discussed for days 2 through 14. Continue this diet for 3 to 4 months of healing or until our office has a chance to evaluate the healing process. That pretty much sums up this video. Hopefully it was beneficial, and I wish you a fast and speedy recovery. We'll see you at your post-op.